Well, a warm welcome to today's talk, Tuesday the 15th of February. I want to do a bit of a brief update today and ask some questions on the data we're getting, and perhaps at this stage in the pandemic, more importantly, the data we are not getting. Because basically we're going quite nicely through the Omicron wave now in the UK and the United States. Now, there's still difficulties to come because patients are still in hospital, there's still people dying, but all the trends are in the right direction. Let's just illustrate that with this general slide here, first of all, for new cases. Now, first of all, this data in India here, there's very few new cases in India. This actually is genuine. I know quite a few nurses and doctors in India, and I've been talking to them, and their wards are just emptying of COVID patients. So good to see that is happening, and we can assume now, I think, that Omicron has generated large amounts of herd immunity in India, because the vaccination rate never was that brilliant in India. It was a lot lower than other countries. Cases in Canada also going down, although we know that testing's very questionable there. United States cases going down, again, testing difficulties, but we do know that that's a genuine reduction. Australia, well, this is Australia here, this green line. It's certainly come down quite dramatically, but of course, Western Australia still to open up as yet. And why there's still this delay in opening up Western Australia to allow Omicron in, as it inevitably will come, I really don't know. It doesn't make a lot of sense that Western Australia is not opening up now. Nevertheless, it isn't. The borders are still closed down. United Kingdom cases are definitely coming down. Germany, they're going up. And interesting here, we have Netherlands, remarkably high cases. And what's happened with Netherlands is basically they're just a bit behind us in the Omicron wave. That's what this means. And if we look at the cases here, we see that it's all Omicron basically. Still a little bit of Delta there in India according to this, but I can't imagine there's much. So basically United Kingdom, United States, Australia, Netherlands, Canada, Germany, virtually all Delta, as Delta has displaced Omicron despite the reservations from our chief medical officer. It is clear that Omicron has displaced Delta, as indeed we anticipated on this channel, to be fair. Number of COVID-19 patients in hospital. Now, this is unlike the tests. I mean, the tests, obviously, the cases are only a subset of the actual infections, whereas this is genuine data we're looking at here. We know this is correct. So number of patients in hospital per million in the United States going down fairly dramatically. Canada also going down, the United Kingdom also going down, Australia going down, although there should be a blip on that when Western Australia opens up. Netherlands going up slightly. So this just shows Netherlands are just a bit behind, but when you look at the cases in Netherlands, which were there, then it's not surprising that hospitalisations are going up a bit. They could continue to go up for a bit longer. In fact, they probably will, but hopefully not reach high levels, because of the reduced pathogenicity of Omicron and the large amount of immunity present in the population. So this is deaths here. Now, the United States, for reasons we've looked at many times, for example, the comorbidities and things, the deaths in the United States are high, but they are starting to come down. This downward trend, I'm sure, will continue, but still really quite high. Canada, United Kingdom, Germany, Australia. Canada, the deaths are coming down. United Kingdom, they're coming down. Actually, Germany, they're still going up there. Australia, they're going down. But again, Germany is a bit behind the United States and the United Kingdom. Netherlands, deaths remain low. India, deaths are genuinely from COVID, genuinely low. I know they're not all reported, but they are genuinely low. Now, this is the reproductive number here. And this is really important because it shows where we're going over the next few weeks. And the data is remarkably encouraging. This really is pretty good news. The Omicron wave is going down nicely. So that's the R value of 1 there. So as you know, anything above that, so that's the one, that is the 1 line there. Anything above that is increasing. So Germany and Netherlands, we still see that the rates are increasing, although the rate of increase has decreased. But still, it's above 1. That means the number of cases are increasing. The United Kingdom is below 1, so our numbers are now decreasing. Canada, Australia, the United States, India, all well below 1 and mostly seem to be heading down, although you could argue the UK is flattish. But remember, this is all under 1, so the number of cases are going down in the UK. So pretty encouraging data. Now, all the links for all this are here. We are evidence-based as far as we possibly can, so do click on all those links. Now, I want to talk about the Office for National Statistics now. Now, I'm just going to show you some pictures here from the Office for National Statistics and other places. So here we have the data from the Office for National Statistics in the UK. So in England, dementia and Alzheimer's disease remain the leading cause of death. So I've put this up to show the comparison, because the deaths from COVID-19, where COVID-19 is the main cause, are going down. So we see dementia and Alzheimer's, ischemic heart disease, chronic lower respiratory disease, COVID-19, cerebrovascular disease. Now, there is a bit of a question here, because according to this, malignant neoplasm of the trachea and bronchus comes next, then influenza and pneumonia. Symptoms, signs of ill-defined conditions, malignant neoplasm of the colon, sigmoid and anus, malignant neoplasms presumed to be primarily lymphoid or hemopoietic. That's the blood-related sort of cancers. So good to see that COVID is coming down, but I've got some questions about the way this data has been given, because I looked at this and I thought, well, just a minute, where's breast cancer? Because breast cancer is by far the most common cause of cancer in the UK. I mean, actually, the most common cause is the non-melanoma skin cancers that doctors take off routinely all the time, but we don't count those because they don't cause much of a problem. But this is from the Office for National Statistics, and they do say these are the main causes of death. But let me show you this data here. This is these are cases from the these are 10,000 cases per year. This is from the Cancer Research Council, and we see breast cancer is by far and away the most common, then prostate, then lung, bowel, melanoma, skin cancer. So that doesn't really quite tally with the Office for National Statistics. Now, I can only assume that the Office for National Statistics are using this as an illustration rather than definitive data, because I don't really quite understand what they're doing here, actually. Hopefully someone can correct me. It's probably just me being a bit dozy, but it doesn't quite add up. So let's look at the most common cause of cancers anyway. So this is 10,000 per year, 20,000 per year, 30,000 per year, 40,000 per year. Breast cancer, very high levels. And also notice, breast cancer does occur in men. Not often, but it does. So breast cancer is often overlooked in men, but it does occur. Prostate cancer, of course, can only occur in males, because females do not have a prostate gland. The prostate gland is the gland that produces some of the fluid component that the sperm swim in, part of the seminal fluid. Is the prostate gland, and it causes all sorts of trouble as you get older, as many of you watching are only too aware. So they're the order of cancers in that order in the UK, and that's just to finish off the list of the top 20 cancers there. So it just seems a bit strange. While I'm on it, I'll just show you, because it's quite interesting. 10 most common cancers in males in the UK. Prostate cancer is the most common in men, although you could kind of say, sounds a bit strange to say it, but the thing about prostate cancer is you could say it's the good thing about prostate cancer, although there's nothing good about prostate cancer, but it tends to occur in older men, whereas testicular cancer, last time I checked, although it's much less common, the peak age for testicular cancer is 31, so men in their 20s, 30s typically can get prostate cancer and need to have a high index of suspicion for that. But carrying on with these cancers in men, head and neck, kidney, and we can see the list there, bladder, esophagus, leukemia, other sites. So well worth thinking about the lifestyle factors that could contribute towards some of these cancers, and of course how to avoid them. And then in females, 10 most common cancer, breast by far and away the most common. And breast cancer, as we saw, the most common cause of cancer. If you take men and women together, breast cancer is still the most common. Can affect relatively young women, especially if you have the BRCA, the BRCA mutation, BRCA1 or BRCA2, which can be screened for. Lung, bowel, uterus, ovary. Ovary is an awkward one because it often presents very late. So breast, lung, bowel, uterus. Now, I don't know if I wouldn't have thought uterus contains cervical cancer because we're screening for that. So that's done a very good job on reducing the incidence of cervical cancer. But so quite what the Office for National Statistics means by its data set there is not entirely clear. But let's get back to the COVID. I think just before we do that, we'll look at the South Africa situation. Now we did look at this. We looked at this repeatedly. Where are we? We looked at this graphic repeatedly for quite a few weeks. Here we are, when we were looking at South Africa. And this is the pandemic in South Africa in terms of Omicron. It went up quickly and it went down relatively slowly. But these are only weeks, you see, so this is obviously the data for the 7th week of the year is incomplete. But it went down pretty quickly. And then when we look at hospitalisations in South Africa, currently, with a COVID-19 diagnosis in hospital in South Africa, there's 3,800 patients, and this is from a population of 60 million people. So the wave is very largely over here in South Africa. Really good news. Very low numbers of patients in ICU, very low numbers of patients in high care. And again, we know that many of these patients that are hospitalised are not there because of COVID, but for other purposes. And here we see the number of patients currently ventilated. 111 patients in South Africa currently ventilated from a population of 60 million. It's pretty good ventilated for COVID. And 384 patients currently oxygenated. So South Africa wave passed over really quite nicely. And I'm expecting the UK data to be fairly comparable to that. But carrying on here with the Office of National Statistics, week ending the 5th of February, of course it's the 15th now, so 10 days out of date, but it's what we've got. BA1 is currently the dominant variant across the UK. Now, I had expected BA2 to take over from BA1 much more quickly, rather like it did in Denmark. It is happening, but it's happening much more slowly than I had anticipated, at least. I think quite a few people anticipated it would be quicker. BA2 has increased substantially in Northern Ireland and some regions of England, and it is increasing. It will take over eventually, but it's taking much longer than we thought, or largely take over. Now, prevalence is still high. There's an awful lot of immunity being generated in England as we speak. So in that week, ending the 5th of February, 2.8 million people, 1 in 19 in England, had the infection. Wales, 1 in 25, Northern Ireland, 1 in 13, Scotland, 1 in 25. So we'll have to try and get some clarification from the ONS for this. Because it says figures 4 and 5, which is the one we looked at, showed the 10 most common causes of underlying causes of death in the UK. But it didn't show those common causes of cancer, so I'm not quite sure. I assume this is just some miscommunication from the Office for National Statistics. And of course, the other thing about the Office for National Statistics, the data it's not giving us that we asked for, or at least I can't find it, is we want to know what the risk of getting sick and the risk of hospitalisation is for the 9% or 8.5% of people in the UK that are completely unvaccinated, therefore comprise a nice large cohort. What is their risk of infection? What is their risk of getting sick? What is their risk of hospitalisation? What is their risk of death compared to people that are vaccinated? So people that are not vaccinated but have had infection, and it wouldn't be hard to get this group. I'm sure we could quite easily get 1 million people in the UK who have not been vaccinated but do have had the infection. How is their level of protection measuring up against those who have been vaccinated? Because the data we've got from California and the United States is showing that if you've already had the infection, there is minimal, if any, benefit to being vaccinated after that. Now, Fitz asked this question, which costs more, an antibody test or a vaccine? And he says that will determine policy. So basically we need to be doing antibody tests on everyone. If people are testing antibody positive, that means they've had the infection. Then before they're vaccinated, I would like to see some evidence for the efficacy of vaccine in that group. But the Office for National Statistics just doesn't seem to be giving us that data, unfortunately. Now, they could well start giving us this data soon, because times have changed in Omicron. Omicron's changed the risk-benefit analysis. Omicron's generating huge amounts of natural immunity. So it would be good if we could start getting that data. This is from the Cancer Research Council here. Great website, go on it. You'll be on there for ages. So much fascinating stuff on there. Breast cancer is the most common cancer in the UK, accounting for 3 in 20, 15% of all cancers in males and females combined. Quite appalling. And nearly all of those cases in females. Next most common cancer, prostate, lung, bowel. Though there are 20 more types of cancer that we looked at. Just 4 types, breast, prostate, lung, bowel together, which account for 53% of new cases in the UK. So it's just strange that the UK, the ONS didn't seem to be aware of the breast or the prostate cancer. Yeah, strange, I can't really explain that. I'm sure there's a perfectly innocent explanation. I'm not saying that sarcastically, there will be. But why it's written as it is could well be an oversight. But the big thing, ONS, please, data comparing people that are vaccinated with people that are not vaccinated but have natural immunity. That's what we need. So Fitz asked this question, which costs more, the antibody or the vaccine? The antibody test or the vaccine? At the moment, I think the antibody test costs more than the vaccine, I think. In most places, it will depend where you are. Now, Fitz suggested that this determined policy, as if money is the main factor here. Well, some cynical people might think that, but it's not just the money. It's where that money goes as well that's also a factor as well. So that might need to be factored in. But we certainly need to be doing mass antibody testing to make medicine individualised again. Now let me just, I was going to go on to this ivermectin thing from Oklahoma, but I think I might leave that now because I've gone on a bit today. Let's just look at some data, then we'll probably leave it there. Now this is from the United Kingdom. So first of all, cases in the UK. Well, look at that. I mean, they're just going down really quite satisfyingly and dramatically. So if we look at the last 3 months, for example, and we look at the last month, we've got a very good reduction. That's the last 6 months, shows us the wave. So that's the number of patients actually, yeah, that's the number of patients testing positive. So that is definitely going down dramatically. Now let's look at healthcare, which of course is the other main variable that's so important. And again, we see that patients, let's see the 3 months, definitely going down. That's patients in hospital. The patients being admitted, of course, that's a bit ahead. That's going down really quite nicely there. And what's always stayed low with Omicron is the patients in intensive care. So again, last 6 months, last 3 months, last month. So good reduction overall in the number of people in intensive care with COVID. And we will look at deaths as well. How we're doing there. Well, again, the trend is. Well, weekly deaths on the death certificate. What is the trend? It's starting to go down. I think it will go down now. It's time for it to go down. This data is projected to go down as we see. So the projected data is downwards, but it's the last indicator, of course, to go down. Is this a downward trend here? Hopefully it is. But of course, if we compare it to the death rate overall for the pandemic, that puts that into context as we see from previous waves. Centres for Disease Control. Now, here they say COVID boosters, get your COVID booster to increase your protection from COVID-19. But of course, the question is this always true? So that would be a frequently asked question, because if you've already had natural infection, is this statement still true? So let's go on to this and have a look. So here we've got the COVID-19 booster site, and I think there's some frequently asked questions down here. Frequently asked questions. Do booster shots use the same ingredients as existing vaccines? I think they do. If we need a booster shot, are the vaccines working? What are the risks of getting a booster shot? Am I considered fully vaccinated? Does the definition of up to date include a booster shot? Unfortunately, the question I would like to ask is, does the booster shot confer more immunity than the millions of people that have been exposed and infected by Omicron over the last month or so? And unfortunately, that question's not there. So if you live in the States and you can ask the CDC this question, then that question will be asked frequently, and then hopefully it will be asked, because that's the big question in my mind with the change in the risk-benefit analysis that Omicron has brought us. So cases in the States, well, no question there, dramatic reduction. Good news, obviously, if you look in different states, there's a slight variation in that. Deaths in the States, as we've said, still disappointingly high, but are starting to go down. Hospitalisations, this was South Africa, so you've already seen that one. That's just the reference for that. That's the Office for National Statistics, so we've seen that. So I'm getting a bit mixed up here. But anyway, we've seen quite a bit of data there. Actually, I'll just show you this from the Office for National Statistics, just to show how many people have immunity. 98.1% of people have antibodies now in the UK. So we are dealing with really quite high levels of immunity. And that is the cancer research site. Do go on that. I've given it there. Well worth a good look around. Now, I think we'll leave that there, because that's quite a lot of data. So we are seeing very encouraging trends. The deaths are lagging, but we always knew they would. In the UK, I haven't checked this week's data, but as far as I know, overall deaths, at least from last week, there were certainly overall deaths were well below the 5-year average, which is encouraging to see. So we'll leave that there. I'll probably come back and do this ivermectin one shortly, because it is quite interesting. It's about the legal implications, or at least an announcement from Oklahoma. So rather than have a video that goes on forever and ever, we'll leave that there. And thank you for watching. I'm really quite encouraged. I'm hoping to spend a bit more time in my allotment. You know, the weather's starting to get a bit better now, so here we are. It's actually, it's not brilliant, but it is getting better. So I plan on planting some onions and potatoes really quite quickly, rather than spending quite so much time doing videos, because the pandemic really is winding down. Now, it's not over yet, but the directions are good, and we expect Boris Johnson, the British Prime Minister, to announce this week that it is basically going to be ending all COVID restrictions essentially in the UK, including the need to isolate, by the end of February, we're expecting. And if he does that, that should accelerate the rate of natural immunity being generated in the United Kingdom. So thank you for watching.